Hi, my name is Rachel Wilkinson. This is my volunteer patient, Teresa. I'm a current family nurse practitioner student at Maryville University. Teresa is my volunteer patient. We're going to do the head-to-toe assessment. Before we get started here, Teresa, we did her vital signs. We got her height and her weight. She emptied her bladder. We tested her near vision on the Snellen chart and her distant vision on the Rosenbaum chart. And she has changed into some comfortable clothes. I washed my hands thoroughly, and we will go ahead and get started. So first we're going to start with the scalp and the head. The head is normal cephalic. We will go ahead and palpate the scalp, noting for any masses or lesions. It does move freely. Okay. And we will palpate the facial bones, noting for any pain or tenderness. We will also inspect the hair and palpate the hair, noting for any areas of alopecia, and it is in fact distributed evenly throughout. We will go ahead and palpate for the temporomandibular joint. So I'll have you go ahead and open and close, noting for any areas of popping, clicking, or pain. And then we will go ahead and palpate for the sinuses. So we will do the frontal, the ethmoid, and the maxillary. And that's also checking for any areas of pain, tenderness, or swelling. I will go ahead and test the cranial nerves. I'll have you puff out your cheeks, clench your teeth, smile, stick out your tongue, squeeze your eyes tight shut, and wrinkle your forehead. Okay? Great. Now we will go ahead and move to the eyes. The eyes are midline, and I will have you go ahead and look up. The sclera is white and the conjunctiva is pink and moist. Okay. And then we will go ahead and look. I'm going to have you look here at an object on the wall, and I want you to cover one eye. Okay. Uncover, and now cover the other eye, and uncover. Okay. And then I want you to go ahead and cover that first eye again. I'm going to cover mine as well. I want you to look at me, and I want you to tell me whenever you can see my fingers.
I can see it. I can see it. I can see it.
Okay. And we're going to do the other one.
I can see it. I can see it. I can see it.
Okay. And that's just checking for peripheral vision. And then we'll also do the cardinal fields of gaze. So I'm going to have you just follow my pin light. Keep your head stationary, okay? Okay, great. And that's also checking for any areas of nystagmus or any extraocular eye movements. So we will go ahead and do the direct and consensual test here with the pin light, checking the cranial nerves. So just look straight. And here's direct and consensual. And direct and consensual. Okay, great. And now we will go ahead and move to the nose. The nose is midline, and there's no nasal flaring. Okay. There's no nasal flaring. I will have you go ahead and lean your head back. Nasal turbinates are pink and intact. There is no drainage. The septum is midline. It is not deviated, so that is good as well. Go ahead and put your head down. We're going to test patency, so I'll have you check one nostril. Okay, and then breathe in. Great. And then do the other one. All right, great. So now we will go ahead and do the ears. I'm going to first inspect them. We will slightly palpate here. Palpate the auricle for any pain, any areas of tenderness, any bumps, masses, or lesions. Okay. And then we will look at the tympanic membrane through the otoscope. And it's just checking to see that it is pearly gray and intact. There is no drainage. And the same with this one. It is pearly gray and no areas of drainage. Okay. And we will also test the light sensation on the face. So I want you to close your eyes and tell me if you feel this equally on the forehead.
Yes.
And extend upward and outward. And then the lacrimal apparatus here with the eyes is also, there's no areas of swelling, tenderness, or pain there as well. So we will go ahead and move towards the mouth. With the ears, we're going to do the hearing test. We're going to do the Weber test. What I'm going to do is I'm going to strike the tuning fork and place it on your head, and I want you to tell me when you no longer hear it, or if you hear it unilaterally.
Yes.
Okay. And then I will do the Rennie test, where I strike the tuning fork and place it on your mastoid bone, and then by your ears. So tell me when you no longer hear it.
Okay.
Okay. And now tell me when you no longer hear it.
Okay.
Okay. So air conduction should be twice as long as bone conduction, and that was good. So now we will move towards we're going to do the whisper test as well. So I'm going to go behind you. I will whisper a word, and I want you to tell me, repeat the word back to me.
Apple. Orange.
Okay. Now we will move towards the mouth. The lips are pink and intact. They are symmetrical. I will have you go ahead and open the mouth. We will inspect the teeth, noting for any missing teeth, any obvious cavities. The gums are nice and pink. No lesions are noted. No mouth sores. I'll have you stick out your tongue. Okay. And the tongue is nice and pink. It is midline. It's not deviated. I'll have you lift your tongue. Okay. And look for any signs of oral cancer. You can move it to the side. Okay. And the other side. Okay. Great. And then I want you to stick it way out and say ah. Okay. The uvula is midline. It rises evenly with the soft palate. The tonsils are nice and pink, and they fit within the tonsillar pillar. In the pharynx, there is no drainage. It is red. The tongue is nice and beefy red. And like I said, the gums are nice and pink as well. The soft palate moves evenly with the uvula, which is also midline. So now we will go ahead and do the Garrett reflex. Put it open. Okay. And then we'll go ahead and move to the neck. So first we're going to look at the trachea and note that it is midline. There's no deviation there. Then we would also palpate the thyroid here. However, Teresa does not have a thyroid, so we will not be palpating that or auscultating it because there will be no sound, no obvious bruit. There are no obvious pulsations. The skin is pink and uniform throughout. I will go ahead and palpate the carotid pulses. They are 2+ bilaterally. There are no obvious pulsations. There is no jugular venous distension. So I will have you go ahead and we're going to do some range of motion. So I'll have you tilt your head back, and then to that side, and the other side, and forward. Okay. And then I'll have you shrug your shoulders. Okay. Great. Now that was testing. That was testing cranial nerve function. Okay, so now we're going to auscultate the carotid artery with the bell of the stethoscope. Go ahead and hold your breath. And breathe. And hold your breath again. And breathe. Okay, good. And we will do the lymph nodes. So we're going to do the preauricular, the postauricular, the occipital, the tonsillar, the submental, submandibular, the deep cervical, and the superficial cervical chain, the posterior cervical chain, the supraclavicular, the infraclavicular, and if you can raise your arms out, the axillary. And there should be no areas of pain, tenderness, swelling with any of those, and that is great as well. Now we will go ahead and move to the chest. skin is uniform and pink throughout. There's no obvious lesions, no pulsations. So we will go ahead and palpate the chest, or just the chest wall, noting any areas of pain or tenderness. And then we will also palpate for tactile firmness. So I'm going to have you say 99.
99, 99, 99, 99, 99.
Okay, and that's great. Now we will go ahead and palpate the chest wall in a symmetrical, or percuss the chest wall in a symmetrical fashion. Okay, and then we are also going to, I'll have you put your arms up on your head, or you're going to do this laterally as well. Just feeling here for any areas of tenderness. Okay, and then we'll percuss this as well in a symmetrical fashion. Noting for any areas of dullness or hyperresonance. We will also go ahead and auscultate the lungs. Take a deep breath. And then we'll do it laterally as well, so if you want to raise your arms again. Deep breath. That's good as well. And we will also, over here on the chest, we will palpate the precordium. Noting for any heaves, thrills, or pulsations. And the apical impulse. Noting rate and rhythm of the heart. And we'll go ahead and listen to the heart sounds. This would be aortic. And pulmonic. Herb's point. Tricuspid. And mitral. Okay, S1 and S2 is heard throughout, and there were no murmurs. We'll have you go ahead and turn around for me, and we will inspect the skin right there. Okay, the skin is pink and uniform throughout. There's no areas of pulsations, no masses or lesions that are obvious. So what we're going to do is we're going to palpate the posterior chest wall. Noting for any areas of tenderness, masses, or lesions. Okay, and then we are going to palpate for tactile firmness. So again, I want you to do 99.
99, 99, 99, 99, 99, 99.
Okay. And good vibration sounds are heard throughout. You will go ahead and percuss in a systemic fashion. Just breathe regularly. And for any areas of dullness or hyperresonance. Okay. And then I'll have you lean forward a little bit. We're going to do diaphragmatic excursion, where I'm going to palpate down and listen for a sound change. It'll be right here. Go ahead and take a deep breath. And another one. And then I want you to hold it when you blow out. Okay, I'm going to percuss up and listen for the sound change. Okay, and that's about about 3 to 5 inches, which is what that should be, and this would be done on both sides. Now we'll go ahead and do the thoracic expansion. Go ahead and take a deep breath. Okay, and that's just noting that the chest rises symmetrically and that my thumbs expand outward, and that's good as well. So now we will go ahead and have you turn back around. Or actually, go ahead and just sit right here. And I'm going to also take the lungs back here as well. So take a deep breath. Actually, I'm just going to have you lay down. And first we're going to inspect the skin contour for any obvious pulsations or movements. Okay, and skin is nice and pink. There are no obvious pulsations or movements. Okay. And then we'll go ahead and listen. I'm going to auscultate the vowel sounds. Quadrants. You can listen for 2 to 5 minutes if none are heard. Auscultate the aorta. Renal arteries. Iliac arteries. Femoral arteries. Going to percuss the liver borders. As well as the spleen. It should not be felt. And we're going to lightly palpate the abdomen, noting any masses. And then we'll do deep palpation of the liver border again. Should not be felt. Some deeper abdominal palpation, as well as palpation for the aorta. And now we will palpate for the kidneys. Abdominal muscles as you set up as well, which are good. Okay. Now we will look at your upper extremities with your arms. The hair is distributed evenly, the skin is uniform in color, and then the shoulders are broad and intact, good line with the rest of the body. We will look at your fingers, looking for any cyanosis or clubbing of the fingernails, as well as capillary refill, which is less than 3 seconds. And that's good. Okay, and then we will go ahead and palpate the brachial artery. popliteal, the posterior tibial, and the dorsalis pedis. And those are all 2+ bilaterally. So we will go ahead and do some range of motion with your upper extremities. Put your arms out and push down against me. Okay, and now push up. Okay, great. And go ahead and push out with your legs. Okay, and push back. And then stay with the feet. Okay, and that's testing just some of the muscle mass and strength. We'll go ahead and do some reflexes. Test brachial. Okay. Knee. And the Achilles tendon. Okay. And then we will inspect the legs. The legs are, there's no swelling, no edema. Skin is pink, hair is distributed evenly throughout, and the strength is good. So we will I'll have you go ahead and I'll have you stand up. And we will inspect the spine. So I'll just have you lean forward. Okay, and the cervical spine, under the thoracic spine, into the lumbar spine. And it is all midline. There's no lordosis or kyphosis. There should be no areas of masses or lesions, or pain, or tenderness, or swelling. Okay, you can stand up. All right, this concludes our video. Thank you very much, Teresa.
Thank you.
Okay.